Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to today's podcast. We are talking about the importance of broodmare health and broodmare posture because it's something that's not discussed that widely. And it's an important aspect in terms of, we feel it's an important aspect in terms of foal health. There's not enough scientific kind of research that's been correlated with mare postural function and what the foals are coming out like. So we need to be more aware of this. And there's a lot of times when horses have just become a broodmare because they don't have any other function in the world. And so we have to do something with this horse, so they're going to become a broodmare or they're going to become a recipient mare for embryo transfer. And we don't really take into consideration the function of their body and also how we even care for them. You know, there's a difference when we're looking after a broodmare as opposed to a riding horse, and there probably shouldn't be because the broodmares are potentially carrying the future champions. So yeah, we were discussing it last week, and then all of a sudden we thought, oh, we need to do a podcast on this. Like, why haven't we spoken about this before? So yeah, how are you today, Soph?
I am going well. Yes, I'm glad we're talking about this because the changes that you see in mares, who are in work and then they have foals and then they, either they're going through cycles of having multiple foals, or you've got horses that have sometimes they're out of work for a reason, horses who have been ridden and people say, I'm going to get a foal out of my mare during the time that she's not working, but then they intend for that mare to come back into work. And so there's just lots of important considerations to think about because you've got horses who, if you've got a mare who's had an injury, and then you're putting her out, we're going to discuss some of the factors that influence her body from a pregnancy position standpoint, including, loading and changes in movement, changes in hormone, disengagement a little bit of the body in terms of being a sport horse, as opposed to then becoming somebody who's growing a baby and, is kind of mumming around. So there's lots of considerations to think about depending on what your horse is doing, what you intend for them to do, and how you can support them so that she sort of has a good experience, through very generously donating her body to us, getting more horses in the world. And also getting your horse back to a position where if you want to ride her again, that it serves you both for her long-term soundness.
Yeah, and supporting the foal musculoskeletal health. But before we jump in, I just wanted to give a little shout out about the equinology courses because we've got one coming up for enrollment. So you just need to enroll by February the 20th. But I am the Australian New Zealand instructor for equinology. It's a bodyworker certification. Sophie has also done the course, and the next one is beginning in March the 24th, 2026 in Guyra, New South Wales. And it's a course where you really gain those hands-on skills that you need to be a confident, in-demand equine body worker. And, I don't teach this course just because I was asked to teach a bodywork course. I teach this course because before I became an instructor, I knew a lot of equinology equine body workers, and they were always at the top of my list as progressive people in the industry. Their knowledge, they always had an amazing foundation of knowledge, and they were very progressive in their learning, in their continued education. And some of, the body workers that I rate at the top of my list initially began with equinology. It's an intense course, but it's so well-rounded as an introduction, especially into all aspects of horse care. Like we talk about saddle feet and hoof balance and posture and exercises that you can do to support the horse after body work. And the bodywork routine is so ingrained in anatomy that you become excellent at assessing, which I think is the key to becoming a good body worker. So if you want to enroll in that or look at and get more information, go to equinologyaustralia.com. Okay, now we'll jump back into discussing the broodmare. So broodmares have a fair few challenges, and we need to think about them more than just being a broodmare. Like we need to think about their nutrition and their hoof balance and their functional musculoskeletal health. So, do you want to just touch on some of the challenges that broodmares can face that we need to think about?
Yes. So you've got wear and tear. So this is just coming through the fact that you are going through the process of carrying such a big weight in your tummy, foals plus placenta plus amniotic fluid in the body. So you've got lumbosacropelvic dysfunction can come just simply because of the level of weight and also where the weight is right underneath the tummy. So that is putting a lot of strain on the abdominals and also the abdominal sling. There's a lot of fascial slings there that are supportive, and you've got the linea alba that runs down from the sternum all the way to the pubis,
Pubis.
which is basically the point. If you go from the horse's in between their butt cheeks right up to the very top, that's the region where that all of those abdominals come together and they attach into that space. So you can have traumatic events like a prepubic tendon rupture. We read some studies about case studies of horses who've had rupture of that, and they get this. It's a really significant injury basically to the whole underside of the horse. You can also just have abdominal strain. So there's a few abdominal muscles. Is it four?
Yeah, four, yep.
Yeah, there's actual abdominal muscles. Yeah, four abdominal muscles, and they're just sort of wrapping around through that flank space and all underneath the tummy. So you can strain those simply because they're under constant load or because you're trying to do too much. And of course, when you've got horses who already have pre-existing dysfunction, for example, thoroughbreds, because of the high workload at early stages of their life that they've had to do. And, many horses are retired at the point where they have had an injury. So I think it's less common to be retired completely sound in terms of dysfunction. If you were including dysfunctional movement or dysfunctional areas of the body where structures have been influenced because of the load that they're under, it would include a lot more horses than simply ones who've retired because they've blown a suspensory.
Yeah, I mean, I'd like to just go into that lumbosacropelvic dysfunction a bit more because, just jumping out of the barriers, like 100% of thoroughbreds will have sacroiliac dysfunction or lumbosacropelvic dysfunction. And so being able to recognize that in a brood mare, you can then recognize, you know, that function that's there. So if they're really pointy in their butt, like they've got a hunter's bump, if they really have no gluteal muscle, so there's like a dipping, they're not filled up through their rump. If they're super close between those sacral tuberosities at the top, then there's been a dysfunction in the pelvis. And if that's the case, the ligaments of the pelvic area have been damaged and are not functioning. And for a broodmare to have a foal, the pelvis needs to expand. The ligaments soften as just a part of that hormonal influence. But if the ligaments have been damaged and there's adhesions or scarring, or you have ligament damage under the lumbar vertebrae, or you have fusion, kissing spines in the lumbar, or you have had a tail injury to the sacrococcygeal joint, or the muscles that are attaching to the sacrum have had damage, and so you've got an imbalanced pull on the sacrum, or the sacrum can't move through all of its motions, which is rotation, flexion, extension, and lateral flexion, then you're going to change the way that that pelvic area works as a birth canal and how it expands and how it allows the foal to come through, which can then have an influence on the foal, let alone the mare comfort, with potential birth trauma. And we've talked about birth trauma in a previous episode on foals, our first episode that we did on foals. We talked about like rib fractures, sacropelvic dysfunction. So just standing back, looking at the mare's lumbosacropelvic posture is going to give you a bit of an indication about how that area is going to function. And if they don't have good posture in that area, then addressing that before they get in foal and during pregnancy to help the birthing process and help them to carry a foal. So yeah, I've seen some really horribly posturally functional mares through that area, and I always just think, oh gosh, how's that going to influence the foal, as well as the mare comfort? And also, how does it influence the foal drinking from the mare? Because if they're uncomfortable through their pelvis, then they may not allow the foal in on one side, and it can, have quite an influence on how the foal suckles and also how the mare accepts the foal suckling. Like I've seen some mares that are really cranky about that, and then we address the sacropelvic function, and then everything is fine again. So, yeah.
Especially, and you see that with mares, the instant that their foal goes in for a drink, they'll always close them off on one side, or they immediately tell their foal off every time they drink. And I think it's painful. Yeah, it's quite painful to have that area, if it's hypersensitive because you've got tension and inflammation or even just fascial pull through that space. And then when you have the oxytocin as well, and then you have a letdown, it can be very painful. I have actually read about that in human studies, having a letdown into your breast tissue. There was a osteopathy studies can be very painful. So things like that, they're just things you don't always consider, but they're having an effect on everybody's comfort.
Well, also the fascial tension into that other area, like if they've got problems in their groin, or they've had some sort of a abdominal strain or groin strain, or lumbosacropelvic strain, then the fascial tension on the udder can also be an influence. So, and I know that, remember when I did the myofascial course, we talked about treating gelding scars, but we also talked about treating mares and their udders as well, because it goes right up into that, like where you said, up into the butt cheeks and that pre-pubic area, and you can get a lot of tension up there, especially if they've had slips and slides. So,
Definitely. And there are other considerations there to be made. So at a recent dissection with you, I remember looking from the abdominal cavity up towards that pelvic space, basically where the foal would have to transition, out of the tummy. And and you do see this as well with just mares simply who have had a few foals or they had a very weak core and their tummy starts to drop. When you lift their tail, their perineal conformation, so basically the alignment of their bum hole as opposed to their vulva. So when they kind of get sucked in, the bum hole becomes set forward a little bit. And so when
like
they poop,
suckling.
yeah, you kind of get this dribble of feces over the vulva, and that increases your influence. That's a researched contributing factor to fertility because you have feces entering the vagina.
However,
Um,
it's not a research factor in terms of foaling, which would be really interesting, looking at the foaling process and the
yeah,
foals that come out of mares with that conformation. Like,
yeah,
we deal with it from that like uterine health perspective
yeah.
and fertility perspective, but what about how it changes the pelvic canal where the foal actually comes through. And like we can address these things. Like if you start treating a broodmare, it depends on their age, it depends how set the pelvic structure is, but like I've treated horses where that anus conformation has changed once we've got function. So if we recognize this on a broodmare, then it's important for them to have regular body work, structural body work, like it has to be working on the structure, not just muscle type body work, like actually looking at structural function of the bones. Um, then we can help them with that posture and improve it. And if they're that bad, then maybe we shouldn't be breeding from that broodmare.
Yeah. And another factor being hoof balance.
Yeah.
So Um, it's well understood the hoof balance has a very important influence on the pelvis, all the way up, well, the sacropelvic and lumbar area, because just the alignment of the hoof capsule, but also the medial lateral balance. And because you've got such a big loading increase, lots of broodmares will go quite flat in the feet, because they just have so much extra weight coming through, and
Without
they're
core support. Like,
without core support, and also and because they start to lean back, if you're not loading your feet symmetrically, any extra weight is going to exaggerate the influence on the capsule, on the hoof capsule. So, if you're back on your heels, you're just going to end up with lily pad feet, because, or you're going to significantly turn in one direction. So you're just going to accelerate the process of distorting the hoof capsule. So staying on top of your hoof balance alongside
and that means
the
like,
posture.
5 weekly trims.
Yeah.
Like not just trimming the broodmare because, oh well, their feet are long now, or oh well, they're a broodmare, like we just trim their feet every eight
Three,
to
yeah,
whatever
12,
weeks.
12
Like
weeks. Yeah.
they should be trimmed as a horse, as any other horse in work, 5 weeks, because the importance, like you said, of maintaining that hoof balance for pelvic function and making sure especially that they don't have negative plantar angles in their hind feet to help support that pelvic function. And also because you said because of the extra loading, it's even more important to help them maintain that hoof balance because they're going to have stresses just from that extra loading. So they should be trimmed every 5 weeks.
Did you have some comments about behavior and handling as well?
Yeah, I mean, I think that just helps horses to support their foals. Number one, it's difficult if you can't handle a brood mare, but also it can just, you know, it influences the stress in the mare. So if they're, easy to be handled, and also if there's any correlation with pain and their behavior as well. So we just need to consider what their behavior is telling us, and whether it is like a stability or a pain factor, and then how that's going to influence the stress for their foaling period. And the other thing before we kind of jump forward to nutrition, because there's a bit to say about nutrition, but is if a lot of broodmares are bred because they've had an injury. And as I said before, because they don't have any other function in the horse world, what you have to consider, I've seen some broodmares with significant scarring and injuries. How does that change the fascial tension through the body? How does it change the way that they load? How does it change pain pathways? Just because they've got an injury doesn't mean that we should automatically just go, oh, we'll put them in foal and that's okay. We have to consider the welfare of the broodmare from that perspective, but also the impact that that injury is having on whole body function for that mare and how it's going to influence the birthing process for the foal or the drinking process, in terms of offloading or the effect on core function and stability for that mare. So I think that we need to revisit that in terms of horse welfare and ask, is it okay for a horse that's got an injury that's still painful, scarring that's still painful, to not address that and then just go, well, but it's okay for them to have a foal, even though there's still pain and dysfunction in that area. So yeah, I think we need to think a bit more about horse welfare with injured brood mares.
Yeah, definitely. Definitely. So nutrition, pretty big topic, just
Probably the more
in
researched
that
area.
yeah,
Yeah.
yeah, in that space, and definitely very influential. So, you know, the I remember in the nutrition subject actually at uni hearing that broodmares have one of the highest nutritional demands and one of the most significant needs for a well-balanced ration
Hmm.
because for their own health, simply because just like female humans will give a lot of their bone density, your own tissue, they'll pull nutrients, minerals, vitamins from your own tissue and give it to the foal. So, with an interest in keeping her healthy, you are trying to keep a balanced ration, a calculated one, and not, if you have an interest in nutrition, you often know that bagged feed really isn't a high quality diet for the most part. And so having somebody have a look at your mare's diet, somebody like an independent nutritionist, not with a big company, somebody who looks at the ration and will tell you, you need more of this vitamin, we can add that vitamin, or we need more of, more salt, or your horse needs more roughage, something like that, is a great place to start. And of course, orthopedic diseases in the foal also need to be considered when you have horses with a really higher protein and calorie diet for foals. When it's really out of balance, you risk influencing the body that's being grown inside the mare. So, that's one consideration. And there's also the consideration of the type of food that you're feeding and what kind of energy is being consumed. So there's a difference between um, energy that comes from high NSC foods, like things that are higher in sugar and higher in starch, because they create an insulin spike in the horse. And those are factors that not only contribute to the mare's metabolic health, so her likelihood of developing metabolic issues, but there are now quite a few studies that look at what's going to happen in the foal as it develops over its lifetime. So studies have looked right up until 18 months. They have found that mares who are fed a high NSC diet, so a sugary diet basically, they are, or mares that have been obese, they are more likely to be insulin resistant, the foals, at 6 and 18 months, and they have higher inflammatory markers early in life. So that is correlated to developing laminitis and metabolic issues later in life. And there was even a 2021 study that mares overfed in late gestation had an altered pancreatic islet. How do you say that?
Pilot. Yeah.
Islet development. So that's the insulin factory. And so that is a suggestion that later in life, or even, at the present time, you're going to have metabolic issues in that horse. And so that's, an effect that you're having on the foal inside the mare. You have so much influence over that. It's just a wonderful thing to be able to consider the influence that your diet is having and then shape it so that you are able to put the foal at an advantage for the continuation of their life.
Yeah, so you've really got to consider, a lot of mares, especially probably non-thoroughbred like mares, but mares that have just been left to pasture after retirement, like that they can often be quite obese or tend towards metabolic issues and also just relating to stress that they've had in their lifetime as well. And so if your mare is metabolic, you really need to consider what the long-term effects are going to be on the foal. I've seen a few mares who were laminitic who had foals, so they became more laminitic in late gestation, which was interesting because were reading before about the change in insulin
That's
resistance in late gestation and how they're more prone to that then. So it makes sense that they're becoming more laminitic at that point. And then they put on anti-inflammatories. So you've got the double whammy there of a metabolic mare and how that's impacting the foal's insulin hormonal health. And then the anti-inflammatories and how that's influencing gut health. And a few foals that I've seen where the mares were laminitic, the foals were very reactive. So whether they had gastric ulcers or, whether their systems were just not in balance, but they were not kind of healthy, balanced foals. So yes, you need to get that metabolic aspect really under control before you breed the mare and just be considering the long-term effects that this could have on a foal, and you could be predisposing a foal to metabolic issues and laminitis. And that's along with like lifestyle changes that occur with mares, like they might be their housing could change. Maybe even the stress, some mares have gone from being a thoroughbred in stables to then just being thrown out in the paddock with a group of mares, and then they have to learn how to live, and they've never really lived in that kind of herd environment before. So there's a lot of stress involved in that, which can influence cortisol levels, how much they're moving, um, and then what we do to them pre-foaling. So often people lock their mares up, and what influence does that have on A, stress levels, but B, that natural movement is probably quite important to maintain, that lumbosacral pelvic function in the foaling period. And then if we interfere in the foaling and we pull, which has its whole own issues to the mare and the foal, then yeah, then we've got to deal with the consequences of that. And then the stress of the mare that they've just been moved into a different paddock not long before foaling. Maybe their feeding regime has then changed because they're in a smaller paddock. So we want to keep things, as similar as possible through the entire process. And I think the times when I've seen the least stress is just when mares are kept in their environment, foal is born and only brought up if there's a problem. Otherwise, the mare stays in the environment that it's been in for that entire time. And I'd love to see a study that kind of compares mares that have been left in a paddock environment versus mares that have been brought in and put into a smaller space pre-foaling, and just is there any correlation to foaling like dystocias? That would be an interesting thing. And then we have
yeah.
to consider the effects of, well, if we do have to pull the foal, often then we don't look at the mare afterwards, unless there's an obvious problem, like there's a obvious perineal hernia or there's retained membranes or something like that. Otherwise, we don't really look at the foal again. I mean, the mare again. And so if you've had to, even just post-foaling, the mare should have a biomechanical assessment and check. So when you get your foal treated, which should be part of every
Yeah. We're
foaling,
just assuming that you would do that after listening to our
yes,
podcast.
then you should also get your mare looked at as well. And I understand that a lot of people don't want to have to pay because it's just a broodmare. However, that broodmare is your foal's, your future champion's health as well. And so it's, they should have 2 or 3 sessions of bodywork, foals and mares, to just get them back into balance and help them then, especially if they're going to come back into work or they're going to have another foal, then it's even more important to do that. So
Definitely. And I really do believe that there's a level of profitability in making sure that your horses are
yes,
healthy, because um,
in the long term, especially.
long term, and even if you can give them a break or you can give them more movement and think about how you're going to orchestrate their environment and all the influencing factors. If you look at the timeline of a horse's life and you see the things that influence their posture, And then you say, okay, well, here are all the inputs. She's had a fall, she's had to reduce her movement, maybe she's had an injury, she's had these factors. And then what we're trying to do is we're trying to put enough influencing factors that bring the body back into balance so that you're leaning in a positive direction and rather than letting them fall away. And so that's going to work to the benefit of your breeding program. If you have mare health that sustains them for a longer number of years, you might end up with more foals and a
Yeah.
happier mare as well, which is
Or
great.
just better quality foals.
Yeah. I mean, just even the foals you see that have had the studies that are there on your rib fractures. I mean, the benefit to having a functioning pelvis that the foal has to exit. If you had a decreased level of tension and squeeze on your foal, you're directly getting
Yeah.
a better, yeah,
Yeah.
a better quality animal.
And the foaling process is very stressful for the mare because the mare's body because it's so fast. And so, yes, they have the hormones like preparing the body leading up to that, but it's so quick. So depending on how the way that the pelvis can expand, if it's not able to expand optimally and the ligaments aren't able to soften optimally and the sacrum can't go through, move within its function and the pelvis can't move within its function, then it's probably even like the birthing process is painful anyway, but it's probably a lot more painful and there's a continuation of that factor.
Yeah.
So I just wanted to share one story before we kind of talk about the things that we can do to help mares, is that I had a mare that retained her membranes. And this is something where we also need to consider lumbosacropelvic function. She had had the foal the night before, like about 10 o'clock, and this was about 6 or 7 a.m. in the morning, so still retained membranes. It's an emergency situation for broodmares, and the vet had been called already, but he couldn't get there for another couple of hours. And so I stopped there, did some Bowen, some equine muscle release therapy, and some like craniosacral type work along the lumbar spine, and I felt it shift and also through the pelvis. It was probably 10 minutes of work, and then I left. And 5 minutes down the road, I got a call, and she'd passed the retained membranes, which was pretty awesome because that's the first one I'd been told that it worked, but I hadn't had an opportunity to try it out. And I felt the body shift. I felt the body kind of let go of that. And so, with things like retained membranes, if we can maintain lumbar function, like there's so much fascial tension that can occur in that area. So, again, if we can kind of maintain that lumbosacropelvic function and maintain circulation and lymphatic flow, then we can probably prevent retained membranes. And then if we do get a retained membrane, if you have somebody, you know, like me in your area and your weight, like obviously you always have to call the vet, but it's nicer if we can get the mare to pass it themselves. It's much better for everyone if it passes naturally. We know that A, it's all come out, and that it's come out in a non-invasive way. It's less stressful for the mare, all of those things. So anyway, that's an option to consider. So what are some things that people can be mindful of and do to help support their broodmare?
Body work, pre-putting in foal, making sure that, as you're talking like lumbar, sacrum, pelvic function is there. Also mid-pregnancy. So there are considerations that you should be able to ask your body worker about in terms of timelines. But, middle of the pregnancy is a good time to come in and make sure that everything's functioning well, and also post-foaling. So once you've got your foal on the ground, making sure, like you said, having a structural investigation to make sure that function is there. And if you're coming back in to work, if you plan to bring your horse back in or do something with her, making sure that you have You do have function through that space. So we're talking like all the motions that we talk about, or that a structure, say like the pelvis, if it needs to be able to, flex and extend through the lumbosacral joint, is the function there? Can the horse move through that action? And all the supporting soft tissue can make it happen. So if you can't, then you're just going out there with a disengaged pelvis and a dropped belly and probably reinforcing that system of movement. So
Yeah.
yeah, building fitness is a big one if you're coming back in. Really need to consider pregnancy like a major abdominal event. And yeah, go for your body work and go back through what we were talking about, the factors. Your hoof balance is going to be really important. So making sure you stay on top of your hoof health. And I would say always be using a supplement like Rose Hip Vital or something like that for your horses during that time, because inflammation in the body and comfort is going to be really important.
Yeah, and most broodmares will have a degree of arthritis, that's for sure.
Yeah.
And
Yeah.
I just like to go back to the nutrition, make sure that you have a nutritionally balanced diet and you can work with nutritionists. We have a podcast coming up with a nutritionist talking about general diet considerations for horses, but the importance of not just feeding a bagged feed and assuming that it's nutritionally balanced for your broodmare. It's easier to balance a ration without a bagged feed and just know what you're feeding them and making sure that, the minerals, vitamins and minerals are balanced for a broodmare and that, yeah, they have enough, like flaxseed oil would be really important for a broodmare and salt and sufficient fiber and then making sure they've got a good supplement. They're getting enough calcium, enough magnesium, copper, zinc, iodine, all super important for bone development. And so I can't reiterate enough about looking at that nutrition and that bagged feeds are often not sufficient to give your mare exactly what they need. So there needs to be more than that, and often it actually works out cheaper in the long run. If you are making a balanced diet from scratch, it'll work out cheaper than getting most bagged feeds and feeding enough of that feed to create a balanced diet. So yeah, I think that one's really important. Uh, Otherwise, I think that's all the main kind of things that we want to talk about. But I think an important takeaway for me is that we need to be more considerate of broodmare health and postural function and welfare, and that just because a horse cannot be ridden does not mean that they are a suitable broodmare, or just because a horse has had an injury and they're a mare, it does not mean that they are a suitable broodmare. We need to look at all the other factors, posture, conformation, overall metabolic health. We need to consider all of those factors when we're choosing a broodmare, whether they're a performance broodmare or whether they're for embryo transfer. It's all going to have an influence on your future foal health and function and for the welfare of the broodmare, but also the future of the foal. It's just super, super important.
Absolutely.
Do you have anything else you'd like to add or all
I
good?
don't think so. I think we've covered most things, and yeah, just reiterating that, it's a two-part piece, and not only do they deserve to have comfort and high standards of welfare, but that it's worth it for you as well.
Yeah, definitely. Awesome. So I just want to just talk about the equinology course again and just remind you that there's an equinology equine bodyworker certification coming up on March the 24th in Guyra, New South Wales. And it's just a really high quality bodywork course. It's a fabulous foundation as a body worker. And as I said earlier in the episode, the people who have had this foundation that I knew before I became an instructor, I rated them very highly, which is why I became an instructor for equinology. It is an intense course, but it is so well rounded as an introductory course. And your level of an anatomical knowledge is really where a lot of the benefit is gained. You know which muscles you're touching, and so the familiarity with that gives you a head start in the bodywork industry because you know what's normal and abnormal, and you just gain so many skills from this course. It's such a great foundation. So go to equinologyaustralia.com by February the 20th to register, and I hope to see you in Guyra. Thank you for joining myself, Dr. Raquel Butler, and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights. Reach out with any listener requests or feedback for topics that you'd like to hear us talk about.
See you in the next exciting episode.